It is one of the most common disorders in America. Doctors say clinical long-term depression affects a person's ability to sleep, to eat, and concentrate for months or even years at a time. Depression causes sadness, anxiety, irritability, and in the most serious cases, thoughts and attempts at suicide. The National Institute of Mental Health estimates 15.7 million adults had at least one major depressive episode in the past year. That's 6.7% of all Americans, and mental health clinicians peg the rate of long-term clinical depression at about 5 to 6 million Americans. We're joined now by Dr. Karl Lanocha, a physician and director of education for TMS Health Solutions, which has created a new treatment for patients with long-term depression. Doctor, thank you for coming in.
Thank you.
Reading off some of those symptoms, I'm sitting here, I'm going, check, check. You know, you start thinking about it, and you're like, I mean, I'm wondering how many people out there are walking who may have depression, but have not yet been diagnosed.
Well, unfortunately, it's far too many. We estimate that only about half of all patients with clinical depression ever seek treatment.
And talk about the treatment. So if someone comes in, is diagnosed with depression, most treatments are what, and are they easily accessible to the patients?
Well, the standard approach to treating depression nowadays involves the combined use of an antidepressant medication and often some form of talk therapy. But unfortunately, those treatments do not work for everyone, and that's why it's exciting to have a new treatment like TMS.
Let's talk about TMS, but first, why don't they work for everyone?
Well, everyone's different. Everyone's body chemistry is different.
Okay, Transcranial Magnetic Stimulation.
That's right.
TMS.
Yes.
This is your new treatment. Talk about it. How does it work here?
Well, Transcranial Magnetic Stimulation is a very safe and effective, FDA-approved, drug-free alternative treatment for depression that uses MRI-strength magnetic fields to stimulate specific areas of the brain that we know are affected in clinical depression.
And by stimulating those areas, what are you as a doctor getting out of that?
What we know is that there is an area on the left side of the brain up towards the front behind the forehead that becomes underactive when someone has clinical depression. By stimulating it repeatedly over the course of several weeks, we can restore it to normal functioning.
Where can we go get this?
Well,
is it, speaking of availability, for our viewers here in the Bay Area?
Right now we have two clinics, one in Sacramento, the other in El Dorado Hills, but we are going to be opening 3 new clinics in the Bay Area in early 2006. That will include 2 in San Francisco and 1 right here in Oakland.
Expensive treatment?
Fortunately, TMS is covered by most major health insurance plans. We do actually offer a cash discount for patients who do not have coverage for it, but Blue Cross, Anthem, all of the major insurance companies do cover it.
And so use me as an example for treatment. I mean, if I came to you, I mean, for the TMS, how often? When?
Treatment works best if it's done every day, Monday through Friday, over the course of about 4, sometimes 6 weeks.
I mean, that's a lot.
It is. It does require a commitment, but it works. And it works so well for some people who have failed multiple medications that, you know, it's well worth that time investment.
All right. Any new research signs coming down the line we should know about before?
Well, there are a number of other potential uses for TMS. Right now, it's approved in this country to treat clinical depression in adults, but it will probably be approved soon for treating adolescents and for women who are pregnant and breastfeeding. And there are other potential uses in various other neuropsychiatric conditions, including migraine, headache, and various pain conditions.
Great. Thank you, doctor.
Yeah.
Continue the research. Appreciate it.
Thank you.
All right. Kiba, Mark, we'll send it back to you.